because there's a lot of misunderstanding and there's a lot of confusion about it. And all I can say is when there's an issue like this with so much at stake, I want to hear from the experts, and these are the experts. So I thank them for coming. I asked them, and they said, absolutely, yes, we'll be here in a week, and they did. So I want to say thank you for that. And thank the members who were here today who are concerned. I'd especially like to thank Kimberly Britto, Acting Director of Department of Human Services, Kristin Souza, Medicaid Program Director in the Executive Office of Health and Human Services, and Lindsay Lang, Director of Health Source Rhode Island. The upcoming Medicare renewal will impact many of our constituents, more than 350,000 people in Rhode Island, maybe slightly less, maybe slightly more, but that's a good estimate. And I want to thank us, all of us, for being able to hear from the experts about the process. This is such an important program that impacts many, many people, including some of our most vulnerable residents who are elderly or disabled. The renewal process for Medicaid used to be an annual process, but like so many other things, COVID changed that. The federal government wanted to make sure that people didn't lose their coverage during the pandemic. So I want to emphasize to constituents that this is a routine process that's important and necessary. I strongly encourage you to share this information that you learned here today with your constituents, family, friends, and anyone who may be impacted, and you also may know someone who's impacted. And I think I'll do it. First of all, say thank you. I'll defer to the experts, but I think approximately half of those people from the disability community, and there's a little bit of a different process for them. And I know you're going to explain it all to them. So the 350 sounds big, but I don't think it's as big. So thank you very much, and I'll let the experts talk. Thank you.
Thank you, Speaker. Good afternoon, and thank you so much for having us today. As was said, I am Kristin Souza, and I serve as the state's Medicaid Director, joined today by Department of Human Services Acting Director Kim Britto and Health Source Rhode Island's Director Lang. As well as we have a couple of subject matter experts for the questions later in the event that we can't answer them. So, over a third of Rhode Island residents receive Medicaid coverage, so we greatly appreciate being here today and trying to identify every possible avenue to get the word out about the renewal process over the next year. We have prepared for you a presentation about the renewal process, and then we will open it up for questions. So we'd ask if you could hold your questions till the end. That's appreciated. Today, we're going to talk about what you need to know, how renewals will work, and what Medicaid members can expect in the mail and when to take action, and what partners are doing to help. And so first, we're going to cover what you need to know. Before the pandemic, each person's Medicaid eligibility was reviewed once a year. This process is called a renewal or a redetermination. During the PHE, or public health emergency, the federal government paused annual renewals to make sure that people did not lose health coverage during the pandemic. As part of the last federal omnibus spending bill, Medicaid renewals were decoupled from the public health emergency, and all states must now restart that process. In Rhode Island, on April 1st, Medicaid renewals will begin again, and renewals will take place over a 12-month period. Please note that the renewal process we discussed today only affects health insurance coverage, so it does not affect other benefits, for example, our SNAP program. As you can see in the next, on the slide, on the television screens, renewals will be spread out across 12 months, and it's important to note a couple things here. This is not a one-time thing, as we keep saying, and the questions do come. This is annual. It happens every year. It happened every year previous to the pandemic. And so while this redetermination process will kick off after 3 years of being in a pandemic, it will then continue annually from here forward. So you can see the grid on your screen. One other note, families with children or children-only cases will not start their process until December of this year. I am now going to hand it over to Director Lang, who's going to go into more detail about how the renewals will work.
Good afternoon. My name is Lindsay Lang. I'm the Director of Health Source Rhode Island. I'm going to talk a little bit about what consumers can expect from the renewal process at a high level, and then I'm going to talk a little bit about how Health Source Rhode Island fits into the picture. In terms of Medicaid renewals, we really want to make sure that folks are aware of the general process, but in reality, there are two different renewal pathways, and I'm going to talk about those. First, the passive renewal pathway, and second, there is an active pathway. So taking passive renewals first, that's going to impact an estimated 150,000 Medicaid enrollees. And we call it passive because essentially they'll receive a notice that they've been renewed, that we have the information available to us through our data sources, and nothing further is needed from the enrollee. They'll receive that notice that they've been renewed, and they don't need to take any further steps. With respect to an active renewal, they'll get a notice explaining what process they need to follow, and also explaining the deadline by which they need to take action in order to renew their coverage. That group we're also estimating will impact about 150,000 enrollees. The bottom line is, throughout all of this, our primary goal is to keep as many people connected to coverage as possible. And that leads me into the next slide. I'd like to talk about Health Source Rhode Island. If you're not already familiar with us, we are the state-based marketplace, and we currently help about 29,000 individuals and families enroll in qualified health plans through the exchange. And I want to note that affordability is really a watchword in what we do at Health Source Rhode Island. We connect our customers with federal tax credits that they can apply to their premium in advance every month to help bring down their cost of coverage. In fact, about 6 out of 7 of our customers are able to tap into that federal financial assistance, and about 30% of our customers are going to pay $20 a month or less for their coverage. That's what we do sort of in normal times, irrespective of Medicaid renewals beginning again. In anticipation of this transition, we are putting even more supports in place to help Rhode Islanders stay connected to coverage. As states around the country have anticipated this transition and this restart of renewals, Rhode Island, I'm happy to report, has been regarded as very innovative and at the forefront of efforts to support our residents throughout this transition. So first and foremost, we have a shared system in Rhode Island. So we are able to create a very smooth transition from Medicaid to the exchange when that's appropriate for somebody to retain their coverage. They'll receive a benefit decision notice, which tells them precisely what they can do to stay covered through the exchange once Medicaid ends. Every notice going to somebody who can get covered through the exchange will also be customized to explain what affordability assistance is available to them if they come through the exchange and enroll. I also want to note that there's a 60-day special enrollment period for folks who lose access to Medicaid. That is always available, but it's always good to remind you that that 60-day enrollment period is available to come through the exchange, pick a plan, and enroll. And somebody can sort of activate that 60 days at any point in time during the year-long process that will be kicking off renewals again. Through the governor's proposed budget, and with the support of the General Assembly, we are also taking an additional step that I want to talk about, which is the automatic enrollment program through HSRI. For families, 250% of the federal poverty level and below, and I'm going to give you estimated income levels. So $69,000 a year for a family of 4, or $34,000 for an individual. We're going to provide 2 months of premium assistance help to help them transition from their no-cost Medicaid coverage to coverage through the exchange. For families under 200% of the federal poverty level, so again, I'm going to give you rough income levels, $55,000 for a family of 4, $27,000 for an individual. We're also going to give them that premium assistance for 2 months and automatically enroll them in a plan through Health Source Rhode Island. That is just one additional way that we're really trying to target assistance to individuals and families that we feel might be most at risk of losing their connection to coverage throughout this transition, and how we would like to provide them support. An adjustment period is sort of what we're calling it after 3 years of having access to Medicaid coverage. They'll, again, be able to tap into 2 months premium assistance, and for certain folks, they'll also be automatically enrolled in a plan through Health Source Rhode Island. They can always choose a different plan, they can cancel that coverage, but we know that day one, they'll have access to coverage following the day they lose Medicaid coverage. With that, I'll turn it over to Director Britto to talk a little bit more about the details of the renewal process.
Thank you, Director Lang. So good afternoon, Kim Britto, Acting Director for DHS. I will walk us through the next few slides, which focus more directly on what members can expect to receive in the mail and then when to take action on the renewal process. So on slide 11, there it is. The most important step, this is where we need everybody's help in the room, because the most important step that Medicaid members can take right now is to update their contact information. So mailing address, email, phone number, this is the first step that will help us get notices out to them to ensure that they receive the communications that we send out. So it is, we call it, the most important step in the process. It allows us, like I mentioned, to communicate directly and ensure that the members receive information that will contain the timeliness of when they are expected to return information back to us. So if members have not updated their contact information, they can do so by those bullets listed on the slide. They can contact their managed care organizations. We list them out: Neighborhood Health Plan, our Tufts Health Plan, and United Healthcare Community Plan. They can go online to access their accounts through our healthyroad.gov site or through our mobile application. If they download the mobile app, they can access that if they have smartphones. We also have a live web chat, which is staffed during business hours, and that can be through the resources on the slide. It's at healthsourceri.com. Tap on the bubble that says chat with us to help folks through that process. We have our phone numbers listed at HSRI, and of course, our members can come to DHS field offices that are across the state. So on slide 12, take a little bit of time. I'm not going to walk through each notice. I know our time is a little limited, but what's on the slide are the letters that our members will receive. There's 6 notices in general. It doesn't mean that they will receive all 6. Everyone received letter 1 already. I'll go into that one a little bit next. Notice 2 and throughout notice 6 will go out to targeted population groups along the cycle of the renewal process. There'll be reminders built in at points if we sent out a renewal and we haven't received the information, or confirmation that we have received the information. And then the last notice really is the benefit decision notice, which means we've taken action at DHS in our eligibility system, and we've determined if eligibility will continue or if it will be terminated, and the benefit decision notice includes that information. So slide 13 gives the information around what was sent out to, I think it was 200,000 plus members. They all received letter 1. The communication strategy is what the heading is, be ready, stay covered. That's how we're communicating this. That's our logo, so to speak, or our communication messaging. So letter 1 communicates that the message is to be ready, stay covered. It includes an introduction to the renewal process and that it will be restarting in April, what action items enrollees need to take, and what they can do to protect their information and to report fraud, if in fact that happens. Of course, it's broken down in languages that our members have selected throughout the process. We have a new website. It's our staycovered.ri.gov. It's a central hub across all of our agency websites. It has the latest information related to Medicaid renewals. Our informational slogan, as I keep saying, is the Be Ready, Stay Covered. This site really pulls all the information from our interagency team, EOHHS, HSRI, and DHS. We have additional tools on that website. There's frequently asked questions. There's overview of the renewal process. Members will be able to go there to check on the Healthy Road, their accounts, to see when their individual estimated renewal dates are up. So slide 14, we can go to that. This is really how easy, in some ways, it is for members to be able to get information back to the agency when renewals go out. And if it isn't that easy path where we have the information or interfaces to make the determinations, we're going to ask the members for information. So on the slide, we talk through where they can send that information in. So the Healthy Road portal and the mobile application are two of our technology platforms that customers can upload their verifications or information we've asked for into either one of those platforms. Customers can also go in person to our DHS offices. There's community supports in the agency. There's community supports in the state to help as well. And we have also our central mail room where all of the information can be sent back to, and we have recently launched at DHS an in-person document scan center where members can come to bring their verifications to us. They're scanned into the system, handed back to the customer. We know that receipt and walking away knowing that something was scanned in is important to our customers. So that's an option for them as well. So I think I'm going to hand it back over to Director Souza to wrap us up before questions.
Thank
Bless
you.
you.
So I just want to go through a little bit about our partners who have been incredible through this process in helping us to reach out and to support Medicaid members throughout the next year. We have a very robust group of existing field supports available to Medicaid members through the process. Health Source Rhode Island's navigator agencies provide free assistance to navigating health insurance. Our health equity zones, some of our most trusted members in the community, are on board to help quell customer concerns and help members understand their renewal notices. Certified application counselors at local hospitals, clinics, other organizations will provide in-person renewal assistance. Our managed care organizations, Neighborhood, United, and Tufts, serve approximately 90% of the Medicaid population, and they are available to answer questions. Members can reach out to their MCO by calling the customer service number on the back of their insurance cards. And community-based organizations like United Way's 211 hotline are also available to assist. There are priority populations that we have identified, those who may need additional support in updating their contact information and completing their renewal packets, and those we are most concerned about experiencing a lapse in coverage. You can see the list on the slide. To help provide additional supports for these populations, we have opened applications for mini grants that are available to organizations who serve the priority populations, and who want to provide targeted services and supports. That is live on the website that Director Britto spoke about, staycovered.ri.gov, and that opportunity is open until April 4th. Next slide, please. We recognize that this is a very complex process, and there's a lot of information to digest and to understand, and it's complicated. The website has been launched. It is live. You can find resources, and then here you'll see the messages that we're hoping to have at least gotten across today in this discussion. You know, renewals are happening, and they'll start in April. The most important step is to update your information, ensure that folks understand they should open their mail, sign up for texts if they have that option, protect themselves against any fraud. The changes only affect their health insurance, not any of the other programs they may be involved in. Take action when they receive their yellow notice. There are options for other coverage that are going to be made available to them, and to understand and remember that this will happen every year going forward. So with that, I will close our presentation portion and open it up for any questions.